Dr. Gladstone, thank you so much for talking to me today about treating headaches. When should you take medication when you're experiencing headache pain?
So it really depends how often you have headaches and what type of headaches you have to determine when you should take them. If you're having occasional headaches, once or twice a month, once or twice a week, whether it be tension type headache or migraine, the earlier you treat, the more effective the medications will be. So if you have the medicines on you, if you take them to work, put them in your purse, have them in your desk drawer, you can treat early and the medicines will work much more effectively. In those scenarios, ibuprofen, acetaminophen may work for either a tension or a migraine headache. If you wait till the headache is at peak intensity, the medicines that you have at your disposal are much less likely to work. The caveat is if you have frequent headaches, 15 or 20 or 30 days per month, you should not treat at the onset of every headache. In fact, too frequent use of pain medicines, migraine medicines, can perpetuate and cause headache through a phenomenon called rebound headache, where the medicines can actually make the situation worse when they're used too frequently.
When should you be worried that headache pain is a sign of something more serious?
So there are three main headache presentations. The first presentation is the most rare, and that's a sudden onset of a severe headache, what we call a thunderclap headache. You're sitting at the kitchen table with your family having dinner, and out of the blue, 10 out of 10, incapacitating headache. On those scenarios, you don't go to your family doctor, you don't go to the walk-in clinic, you go right to the emergency department to rule out the most worrisome cause of a sudden headache, which is a bleed in the brain. The second pattern is chronic headaches. So if the headaches are 15, 20, 30 days per month, you need to see your family doctor to have a neurologic examination performed, to look behind your eyes, to make sure there are no underlying medical causes for the headaches, and to consider evaluation with imaging, a CAT scan or an MRI scan. The third pattern of headache is the most common pattern, which is the headaches that are intermittent. They come and go a few times a month, a few times per week. In that scenario, urgent medical attention is not required. CAT scans, MRIs are not only not required, but are discouraged. In those scenarios, speaking with your family doctor would purely be to ensure an accurate diagnosis and to ensure optimal medical management of the headaches.
Thank you very much, Dr. Gladstone.
Thank you.